Let me now introduce today's panel of faculty, Dr. Aravind Narayanan, Dr. Abhyuday Kumar, and Dr. Ananthapadmanabhan. Please introduce yourself and get the session started.
Hi, good evening. Am I audible? Dr. Aravind here from Chennai.
Yes.
Yes.
Yeah, so I think this is a nice platform. All across India, we are all joining in to help our students. And we want them to do really well, come out as Olympians in flying color. So we are going to start off today's session.
Hello all, I am Dr. Abhyuday Kumar from Patna, and I would like to wish all of you happy Holi and all the delegates best of luck. Thank you.
Thank you. Dr.
Good evening, all.
Ananthapadmanabhan, please.
Good evening, all. My name is Dr. Ananthapadmanabhan. I'm from KMCT Medical College in Calicut, Kerala. I wish all the participants of the ICA Olympiad all the very best, and I hope that these preparatory sessions will help you in preparing for this exam. Thank you.
Yeah, welcome, Dr. Abhyuday and Dr. Ananthapadmanabhan. So today, all of us, I think our names start with A. So please don't mark all the questions with choice A. You will have multiple choices to mark them for. So we get started. I think as Dr. Saneesh would have maybe mentioned, and some of you would have attended the preparatory session on day one, we would be having three types of questions. We start off with question one, which will be of type A, that is the single best answer type. So I'll be reading the question and then I guess it will be open for polling. Is that right, Saneesh? Through the same browser window?
Yes.
Okay.
So it will be Zoom poll itself. So you need not go to another window.
Perfect. So let me read out the first question. It's fairly simple and also starts with the letter A. So an apnea-hypopnea index, abbreviated as AHI, of 3030 means what? We have four choices over here. Remember, the most appropriate choice has to be selected. Choice A says episodes of hypopnea are 30 times more common than apnea. Choice B, apnea-hypopnea episodes occur at a rate of 30 per sleep cycle. Choice C, we have episodes of apnea and hypopnea occur at a rate of 30 per hour. And choice D, apnea-hypopnea episodes last 30 seconds. So these are the four choices. We expect the students to make the single best choice and submit it.
Fine. I think we can end the poll and discuss the answers. Yeah.
I think now we are able to see that.
Okay, great.
I think equal number of you have about 40% each have answered choice B, and some of you have answered choice C. The first choice of hypopnea being 30 times more common than apnea has been discarded. Most of you have said it's not the right answer, which is fair enough. The choice D, apnea-hypopnea episodes lasting 30 seconds, around 10% of you have polled it. But there seems to be a question or a close distraction between choice B and choice C. The correct answer for this question is choice C. That is, episodes of apnea and hypopnea occur at a rate of 30 per hour, not 30 per sleep cycle. I think this is an important index which we use for people with obstructive sleep apnea, with people with sleep disorders, and we would know that they need to be monitored much more closely in the post-operative period after general anesthetic.
Even the last session, one of the feedback that I got was like many people found it very interesting how close they missed the right answer. It was the difference between the best answer and seemingly the best answer. That's what counts. Okay, objective test. That is what.
And that is how the objective choices are also designed to keep distractors very close by. So we need to be extra vigilant and revisit them. All right, shall we go to the next question, Saneesh?
Yes. So this answer is C.
This answer is C.
Okay.
So next question, I think, addresses
1 second.
Genetic disorders. So you will see the pattern of different areas of anesthesia curriculum being visited. So we want to give you a snapshot of the different types of questions which can be framed. I'm unable to see the question yet, but shall I read out the
Yeah.
question before it comes on the screen?
No. Now it comes.
Yep.
Yeah.
So question 2, it says caution is advised when using succinylcholine in patients with Huntington's chorea because, so there are four choices. We need to figure out caution is advised using scoline in which of these? A, they are at increased risk for malignant hyperthermia. B, potassium release may be excessive. C, they may have a decreased concentration of pseudocholinesterase. And D, there may be adverse interactions between succinylcholine and phenothiazines. Huntington's chorea is not very common in India. However, these are all important questions to remember in terms of movement disorders and patients who come. And nowadays it's cosmopolitan, people travel across the world. We need to be careful. Which of these could be the choices which are to exercise caution when using scoline?
Okay, in our platform, exam platform, there is an option to keep for review. You need not submit that answer then and there. You can keep for review. Towards the end, you will be having a window where you will know how many questions you have kept for review later. So you can revisit those questions before submitting your entire answer. That final submit. Before you do that, you will have an option to revisit them. Okay.
I think
Fine.
this should be
So
used when you have doubts about a question or when the answers which you're thinking are very close to each other. Then you keep them for review and come back to them.
good thing is more and more people are now responding. So shall I end the poll and go for the results?
Yep, I think
Yeah.
we'll do that.
Okay. Yeah. So this is the results.
Okay, that seems
Evenly
to be the
distributed.
choices A, B, and C have got about 25 to 30% respondents, which means they seem to be confusing you. Yes, initial first eyeballing, you think that they are increased risk for malignant hyperthermia. However, there's been no evidence connecting Huntington's chorea. Potassium release may be excessive in anybody, but more importantly for burns and for those with stroke in whom scoline is used. Our answer C is the right choice. They have a decreased concentration of pseudocholinesterase, which means the possibility of prolonged apnea time when you use succinylcholine. I think that is the correct answer, and that should be kept in mind. It's a good idea to visit this topic and look for other interactions. So the correct answer for this question is answer C, choice C. They may have decreased concentration of pseudocholinesterase.
Okay. So we will go to the
Moving on
next
to
question.
question 3, low molecular weight heparin. It's a very simple stem. However, it is followed by four choices. Choice A says, is as likely to cause heparin-induced thrombocytopenia as unfractionated heparin. That is the first choice. Choice B is, should be monitored with PTT plus partial thromboplastin time for coagulation effect. C, low molecular weight heparin can be fully reversed with protamine. And D, low molecular weight heparin has a longer plasma half-life than unfractionated heparin. Which of these four are likely to be the best fit with respect to this question?
Interesting thing is all the questions carry equal mark, but you need to distribute time. Like if question looks very lengthy, you can attempt it later. You need to have your own strategy how you are going to attempt it, because once you spend time to read, then actually you are spending time on it.
I guess the strategy also applies to those topics which you're very familiar with and you know the depth of the topic. So attempt it immediately, and those in which you're having a little bit of a doubt, better to keep it for review and come back to it.
Okay. So we'll end the poll now.
Yes.
Yeah.
So question 3 was
These are
about
the
low
results.
molecular weight heparin. I guess everybody sort of arrived at the conclusion that causing heparin-induced thrombocytopenia is same as unfractionated. No, that is the wrong answer. B also only 20% have said it's right, but it should be monitored with APTT. No, and can be fully reversed with protamine. No, I think you got it right. The correct answer is low molecular weight heparin has a longer plasma half-life than unfractionated heparin. It's sort of a very straightforward answer to this question. I'm happy that more than 50% of you have got it right. This is just a trial, but still it challenges and it should challenge your gray cells to come out with the correct answers. We'll move on to question number 5. Yep, we are in number 4 right now. Question
Yes,
number
yes.
4 says, in a given patient, if a creatinine of 1 corresponds to a GFR, a glomerular filtration rate of 120 ml per minute, I guess, which is the normal, a creatinine of 4 would correspond to what? Obviously, here we're looking at your ability to analyze renal function. So would the choice be A, 20 ml per minute, B, 30 ml per minute, C, 40 ml per minute, or D, 50 ml per minute? It's a fairly straightforward question. There's some amount of mathematics involved, but it also tests and assesses how you interpret the values of creatinine, the renal function test, and correlate that to the glomerular filtration rate.
More consensus with this one.
The choices are pretty simple, and I guess more than 85% of the respondents definitely felt that when the creatinine becomes 4 times, the GFR reduces by 4 times. So 120 by 4, 30 ml per minute is the answer given by 85% of you, and choice B is the correct answer. That's nice. Some of you are still a little confused, but good to revisit this topic again. Going on to question number 5. Back to again some of the syndromes, and this is a very common syndrome, trisomy 21. The incidence of each of the following is increased in patients with trisomy 21 or Down syndrome. So the choices given are, remember, there is a word called except at the end. So just don't jump into the question. Read the full question and then analyze. The incidence of each of the following is increased in patients with Down syndrome, except. So the choice A is malignant hyperthermia, B, congenital heart diseases, C, smaller trachea, and D, atlantoaxial instability, occipito-atlantoaxial instability. So the keyword here is except. It's a fairly straightforward question. If you know the general anesthetic implications of Down syndrome, you should be able to put your finger immediately on the answer.
I think fairly everybody has answered. So I'll stop the poll now.
Yes, question number 5. The question was all seen in Down syndrome except. Good. I think most of you have got the concepts right. I think congenital heart disease and occipito-atlantoaxial instability are common and they are seen. Some of you got confused. Smaller trachea. Yes, it's called dysanepsis and it's seen in Down syndrome. But the correct answer in this case is malignant hyperthermia. It's not something which is linked to Down syndrome. It's quite a misnomer. Many of us actually feel it might be, but it isn't. So in this case, the correct answer is A, MH. Will we go on to question number 6?
Yes.
Interesting question for those who have been to this outside the OT procedure. Question says, patients who undergo extracorporeal shock wave lithotripsy, ESWL, for renal stones are at increased risk for choice A, venous aerobolism, choice B, pneumothorax, choice C, hypotension with regional anesthesia at the end of the procedure, and choice D, post-dural puncture headache with spinal anesthesia. It's a fairly targeted question which talks about a particular procedure and asks patients who undergo this ESW are at increased risk for. So those who have anesthetized such patients, I think, would be able to recollect and think which of the answer matches best for the question. Yep. So I think people have analyzed it quite well. Thinking about venous aerobolism, most of you have said that is a possibility. Some of you have said pneumothorax, which is again a possibility, yes, but you have to think that it's not the thoracic area, which is so. If you go think about the procedure, it is usually done in a water bath. Of course, nowadays you have newer modalities also without that, in which you have different modalities of interfacing the shock wave. But the classical extracorporeal short film drug C is the patient is submerged in a water bath. That's the reason when regional is given, they come out of the procedure and they may have sudden vasodilatation, a change in the temperature. They'll be vasoconstricted in the water and they come out, they'll vasodilate. So hypotension with regional anesthesia is quite common. However, you all have thought about venous air embolism. That seems to be okay, but they are not directly because it's administered from outside the patient. There is no chance of air actually entering, though some of the air contained cavities might actually conduct the shock wave. But venous air embolism is not the right answer. In this case, it is hypotension with regional anesthesia at the end of the procedure.
So the answer is C.
The answer is C.
Yeah. Question number 7 is which of the following is not a component of model of end-stage liver disease? That is MELD score. So this is a single choice answer, and one of these four options is not a component. So MELD score is actually used to see the prognosis in a cirrhotic patient, and lately it is also nowadays used to prioritize patients on the wait list of liver transplantation. So MELD score is very important, and yes, most of you are correct. That is, albumin is not a component of MELD score. Rest others like bilirubin, creatinine, and INR, all three are components of MELD score. So there are few prognostic indicators of end-stage liver diseases like child-pug score, other is MELD score. Then after the MELD score, we have also MELD sodium score is also there. So in MELD sodium score, all will be there like bilirubin, creatinine, and INR, which are the component of MELD score, with sodium also. And a very recent one, that is MELD 3.0 score, has also came into light. And MELD 3.0 is better than MELD score as well as MELD sodium score. And apart from in the MELD 3.0, all four components are there. Matlab, it has also included albumin also. So if the question is MELD 3.0 score, then the answer will be bilirubin, albumin, creatinine, INR, all are there. And apart from all these four, sodium is also there, and female sex is also there in MELD 3.0 score. So the next question may come as like that only. Can we go on to the next question? So the next question, question number 8 is, this is again a single choice answer. Which of the following has dual effect of increasing gastric pH and decreasing the gastric volume to minimize the risk associated with aspiration? And the options are prochlorperazine, ranitidine, ondansetron, and metoclopramide. So which of these have double effect? Both effects, like it will also decrease the gastric pH as well as it will also decrease the gastric volume. So actually, the correct answer is ranitidine, and as we can see, metoclopramide, some have answered. So this is a close distractor. And ranitidine, cimetidine, all these are H2 blockers, and these decrease the gastric volume as well as decrease the gastric pH. And others like ondansetron is used as an antiemetic drug. Then prochlorperazine is also used as a antiemetic drug. Metoclopramide, yes, it decreases the gastric volume by increasing the motility, but it had no effect on the gastric pH. So the answer will be ranitidine in this case. Thank you. Next question. This is quite easy one. The vessels that provide blood supply to the liver is. This is again single choice answer. Hepatic artery percentage 25% and portal vein 75%. Like that, other choices are there. So you have to choose one of these.
And is the response?
Yes. As expected, the answer is most of the blood supply to the liver is from a vein, that is portal vein 75%, and hepatic artery have only 25% of the chunk. But other thing is that when the question is little bit twisted, like oxygen supply to the liver, matlab, is contributed by which artery or vein, then it is 50% by hepatic artery and 50% by portal vein. So when oxygen supply is asked, go for 50-50, and when blood supply is asked, go for 25 for hepatic artery and 75% as portal vein. Next question, please.
So the next question is, the intravenous anesthetic agent most commonly preferred for neuroanesthesia due to its ability to reduce cerebral metabolic rate and preserve cerebral autoregulation is, you have four options, A, ketamine, B, propofol, C, midazolam, and D, etomidate. So out of these four options, one drug is preferred in neuroanesthesia due to its ability to reduce cerebral metabolic rate, and also it preserves cerebral autoregulation. And this drug is also said to have some neuroprotective effects, due to which this drug is mostly preferred in neuroanesthesia. So most of you have correctly answered propofol. So that is a correct answer. The agent that is most commonly preferred in neuroanesthesia is propofol due to its ability to decrease CMRO2 and also preserve cerebral autoregulation. The next question. During anesthesia for a patient with end-stage renal disease, which of the following is the most reliable method to assess intravascular volume status? Option A is urine output monitoring. Option B, central venous pressure or CVP measurement. Option C, pulse oximetry. Or option D, that is point of care ultrasound focus of the inferior vena cava. So which of these modalities is the most reliable one to assess intravascular volume status in a patient with ESRD?
Okay, these are the responses.
74% of you have answered POCUS as the response, and that is also the correct answer. Point of care ultrasound of the IVC will give us an idea about the volume status of the patient more reliably than the other options. Urine output monitoring can sometimes be not very reliable. Same is the case with CVP, and pulse oximetry cannot give us a direct idea about the IVC intravascular volume status. Point of care ultrasound is, out of all these options, the most reliable method to assess intravascular volume status. So the next question is, which of the following clotting factors is not synthesized by the liver? Option A, factor 7, option B, factor 9, option C, factor 8, and option D, factor 10. So most of the clotting factors are synthesized in the liver, except a few. And out of these options, one of them is not primarily synthesized in the liver. So 94% of you have answered it as factor 8, which is the right response. Factor 8 is primarily synthesized in the endothelial cells, and all the rest of the factors are synthesized by the liver hepatocytes. So that's all for section A, I think.
Okay, we'll proceed with section B. Dr. Aravind?
Yeah.
Okay.
I'm not able
About
to see the
section
question.
B.
Section B, yeah.
Yeah.
Section B.
Section B is multiple response. That is, more than one response are true. So you need to pick all. If it is 2,
Yep.
you need to pick both correctly to score full marks. If it is 3, you need to correct all 3. There is a partial scoring system which we'll be explaining in the next session. So it's very interesting. So shall I launch the first question?
Yeah, I think it's important that they read the question completely and then assess all the answers on their merits. So the first question in this section is multiple response type. Remember, first question is, which of the following cardiovascular abnormalities are likely to be present in a patient with end-stage liver disease? So the first choice is resting tachycardia. Choice B is widened pulse pressure. Choice C, increased peripheral vascular resistance. And choice D, increased cardiac output. So I would advise that you read the question and analyze each answer and check. Either one or all 4 answers could be correct. All the correct answers have to be marked. All the right choices have to be marked. These type of questions usually take more time. They are more challenging. You have to use a lot of analytical skills. So give it some time, give it a thought process, and make sure you assess each and every choice and make them fit. And be very sure you're not going to mark them. These questions, I think, check more the depth of knowledge in a particular topic, and they are very common and famous in all the international exams. So the question Resting tachycardia, 56% of you have answered. Widened pulse pressure, 78% have answered. Increased peripheral vascular resistance, 52% have answered. But the wrong answer in this case would be C, increased peripheral vascular. I think all of you should be realizing that end-stage liver disease has possibility of shunts, and you will have reduced peripheral vascular resistance. So the answer in this case, which will not be right, is C. So your choices should be A, which is resting tachycardia, B, widened pulse pressure, and D, increased cardiac output.
So those who mark A, B, and D will take the full score.
Coming to the second question. I think it's more of a legacy question. Unsure about how many of us would actually be using halothane nowadays, but yes, it's still in vogue. So the question says, what are the risk factors for development of halothane hepatitis? So the first choice is A, prior exposure, B, obesity, C, female sex or the female gender, and D, children. So assess this carefully. Which of these are risk factors for development of halothane hepatitis? It's important to assess your knowledge about the topic. Also think about the clinical performance or clinical usage of that particular question. Many times that helps you guide towards the right answer and also helps you to choose which is not going to be fitting this question. So coming to the poll, 86% of you have said prior exposure is one of the risk factors. That is correct. 49% of you have said obesity is one of the risk factors. That is also correct. Female gender, 61%. But surprisingly, about 70% of you have said children. I think that is the wrong answer because children halothane is used quite frequently. That is the choice agent. So if that is a risk factor, we would not be using halothane in children. So in this case, the correct choices are A, B, and C. D, children, is not the correct answer for this question. Maybe they got confused. Halothane hepatitis, when sevoflurane is more used nowadays in all the hospitals. Coming to question 3. What are the factors that precipitate hepatic encephalopathy? So the 4 choices given to you are A, hyperkalemia, B, large protein load, C, gastrointestinal or GI hemorrhage, and D, constipation. The question is, what are the factors that precipitate hepatic encephalopathy? It could be A or B or C or D. Find out which combination. Think about all the choices. Saneesh, I think we should also advise that they evolve a strategy for answering these type of questions.
Yes, sir.
Wherein they should be writing down what is the most obvious answer and then figure out which is exclusion. So it may be better that way rather than thinking about it in their mind.
Correct. And we can use the keep for review option also in case you need another 10 seconds later. Because otherwise you won't be reaching the question numbers 90 to 100.
Yes,
Don't get
good
stuck
choice will
with
be
the question.
to assess a part of the answers. Out of the 4 choices, maybe you analyze 2, mark them, keep the remaining 2 for review. Rather than going back to analyze all 4 options, you lose more time.
Correct.
Fine. I think if I read this question, what are the factors that precipitate hepatic encephalopathy? What springs to my mind immediately is large protein load and GI hemorrhage. So I would mark them B and C definite. Then I go back to analyzing A and D. So I think you all have done that very well. Choice B, C, and D, all of you have marked. More than 90% of you have marked it well. Some of you have still thought hyperkalemia, but that is the wrong answer. So in this case, the factors that precipitate are choices B, C, and D.
So those who are marked A will get penalized with partial scoring. Okay, we'll go to the next question.
Next is a neuro question. Shall I read it, Saneesh? Shall I go ahead?
Yes.
What factors? What factors should be considered while selecting an anesthetic technique for a patient with increased intracranial pressure? It's a very important topic. It's very important for us to know about it. So, what are the four choices? The factors: A. Maintenance of cerebral perfusion pressure (CPP). B. Avoidance of hypercapnia. C. Use of volatile anesthetics to reduce the cerebral metabolic rate. And D. Administration of large fluid boluses to maintain blood pressure. So analyze this carefully. What factors should be considered while selecting an anesthetic technique for a patient with raised intracranial pressure? You need to analyze each of the choices, and if it's a factor to be considered, you mark them that you're going to answer that choice. If you feel it's not a factor relevant to this, cross it out so that you are able to arrive at the right set of combination of choices. So ICP is a favorite topic. All of you would be dealing with trauma, head injury, etc. So maintenance of cerebral perfusion pressure, choice A. I think it's a no-brainer. You need to do that anyway. So most of you have marked it correctly. Avoiding hypercapnia. Yes, hypercapnia causes further rise in the ICP. So this is very prominent, and all of you have jumped and you have marked it rightly. Now come to C, use of volatile anesthetics to reduce cerebral metabolic rate. About 70% of you have marked it. That's also correct, because volatile anesthetics are not the choice. If you already use Stiva, propofol, thiopentone. What about D, large fluid boluses to maintain blood pressure? No, that's a strict no-no. And all of you have nearly got it. More than 88, 86% of you have said that is the wrong answer. So the right combination of answers for this is A, B, and C.
Now,
Okay.
now we are into hepatic.
So, which drug should be used cautiously in a patient with hepatic dysfunction due to altered metabolism? So, liver dysfunction, altered metabolism, which of the drugs should be used cautiously? Choice A, is it remifentanil? Choice B, is it rocuronium? Choice C, is it fentanyl? And choice D, is it midazolam? You would be definitely managing patients for sedation or for general anesthetics. So go back and think which of these agents should be used cautiously. I think it will be one of the shortest questions in the series today. Right. So around 94% of you have said midazolam should not be or should be used cautiously. That's right. 66% have said fentanyl should be used cautiously too. Correct. Rocuronium should be used cautiously. 70%. And only 16% have felt remifentanil. That's the correct choice here in this case. So which of these should be used cautiously? Yes, it is B, C, and D, and not remifentanil, because it's not going to be affected by hepatic metabolism. So that's, I think, a good approach to this question. Most of you seem to have got the idea behind it. Okay, moving on to question 6 of the type B questions. Which of the following perioperative strategies help prevent renal dysfunction in patients undergoing surgery? It's important to note which of the following strategies help prevent renal dysfunction in patients undergoing surgery. So, choice A, maintaining adequate hydration and perfusion pressure. Choice B, avoiding nephrotoxic drugs when possible. Choice C, using high dose loop diuretics in all patients. Choice D, monitoring urine output and serum creatinine levels intraoperatively. So you have to analyze each of the choices and feel which of the following help prevent renal dysfunction in patients undergoing surgery.
This question I can take over, I think.
Okay,
This
okay.
question.
Yeah,
Okay.
go ahead, please.
Okay, fine. So I'll end the poll. We'll discuss the answers.
So most of you have got this correct. Maintaining adequate hydration and perfusion pressure is preferred. Avoiding nephrotoxic drugs is also a necessity in this case. Monitoring urine output and serum creatinine levels intraoperatively can also help in monitoring the renal function. But routine use of high dose loop diuretics in all patients is not suggested, because it can further cause dehydration, and also it can worsen any type of dyselectrolytemia that is in the patient. So option C is the wrong option, and in this case, A, B, and D are the right options.
Yeah, I think as a group, this is something like a prototype answer, no? So everybody is in the same page, like A, B, and D, correct?
Yes, that
So I
is more or
think
less the only
now
committee option.
yes, yeah. Now we'll go to the section C. We'll introduce the section C. I think everybody remembers what exactly is the requirement with section C. There will be an assertion statement, reason statement. Check whether statement A and statement A are correct. If they are both are correct, see whether they are related. Like reason statement explains the assertion statement. Otherwise, either one is right. Either assertion is right, reason is statement is wrong, or assertion statement is wrong. Reason statement per se is correct. So these are the choices. We'll go to the first question.
Yeah, first question, I
Okay.
think, shall I go ahead, Saneesh, or
Yes, yes,
Abhyuday is
yes,
thinking?
yes.
Okay, so I guess these questions are a little complicated to look at. They have to be assessed and thought about, and still leads to a thought block sometimes. Anyway, the assertion here for the question one is earliest ECG sign of hyperkalemia is narrow and peaked T waves. The reason, the second part of the statement, R or reason, is IV calcium can rapidly correct all the ECG changes of hyperkalemia. After reading the assertion and the reason, let's go into the choices. Choice A says both assertion and reason are correct statements, and the reason R is a correct explanation of the assertion A. If you feel this is how it is, then mark A, choice A. Choice B states both assertion and reason are correct statements, but the reason is not the correct explanation of assertion A. So here's where you start thinking and figure out whether choice B could be right. Choice C states assertion A is correct, but reason R is an incorrect statement. Since it's incorrect, it has no role to play in the assertion. Choice D states assertion is incorrect, but the reason is a correct statement. So choices C and D delink the two. So you still have to carefully analyze all four and make your choice.
Okay, section C is something we need to stress on. So from the delegates, if you want to come over with your microphone to discuss and explain what you think about the response, raise your hand. I'll allow microphone for you. Okay, this is a practice session, so we'll make it more interactive.
Correct. I think it's also for them to realize some of them would know about this type of questions. These are fairly
Yeah.
common in the fellowship exams of different boards of the world. So you need to know the concept in depth before answering this question. I think this section, Saneesh, the choices A, B, C, and D remain the same for all the questions, correct?
Yes, correct.
That is one positive thing you should understand, that you know that these are the only four choices available for any question, which means you don't have to spend time reading the choices again and again. But it's important to read the
Correct.
assertion statement and the reason statement repeatedly and start matching whether each of them are correct in their own respective ways. If they are correct, then do they explain each other? Isn't it, Sanish? Is that how is the best way
Yes,
to go
correct.
about it?
Yes. So nobody wants to volunteer, then we'll continue with our discussion.
Yes, this is a higher level skill wherein you are supposed to interpret the assertion statement and the reason statement. But remember, they themselves can be wrong in their own respective ways. Okay, so about 47% of you have gone for option B, which says that assertion and reason are both correct statements. So it's important that choice A and choice B both say that A and B are correct statements. So if any of them is incorrect, then you don't have to come to choice A or B. You go directly to choice C or D. So that's important to understand and come to a right conclusion, that is assertion statement correct? Okay, earliest ECG sign of hyperkalemia is narrow and peak T waves. I think that's a correct statement. So most of you have understood that part. The next is the reason statement. What is the reason statement? I think this one doesn't show the reason statement.
Yeah, IV calcium can
No worries.
rapidly correct.
The reason statement says IV calcium can rapidly correct all ECG changes of hyperkalemia. I think the key word there was all. Can it correct all the? No, it cannot correct all the ECG changes of hyperkalemia. So, which means that the reason statement is wrong. If the reason statement is wrong, then both choice A and choice B are out of your spectrum. You now come to choice C or D if one of them is wrong. And here it says very clearly that choice C, the assertion is correct, but the reason statement is wrong. So it's very easy that you can arrive at the correct choice by understanding as analyzing each of these statements independently. Analyze assertion, is it right? Analyze reason, is it right? In this case, reason is wrong. So straight away, your choice becomes choice C. The problem will come only when both these statements are correct. Then you have to think one more step to see whether the reason is a correct explanation of A or not, in which case your choices might be between A and B. So for this question, the assertion statement is correct, the reason statement is incorrect. So the choice would be C. Only about 27-30% of you have answered that correctly. So it's good to go back and read the statements repeatedly, at least 3-4 times in your mind, and then come to an independent judgment whether the assertion is right by itself, reason is right by itself, and then try to match the two. Shall we move on to the next one?
Yes, yes.
Remember, these questions can be tricky, so you need to read the statements carefully. The next question, question 2, the assertion statement says rigidity during administration of a volatile anesthetic after succinylcholine in malignant hypothermia is due to calcium flooding inside the sarcoplasmic reticulum. The reason statement says malignant hyperthermia is a disorder of muscle metabolism, most likely mediated by mutations of the ryanodine receptor. So these are the two statements given as statement A and statement R. Analyze both the statements. If both are correct, your choice has to be either A or B. If one of them is wrong, go to choices C or D, but analyze them carefully and match them. Again, remember, your answer is only one of them. Choices, your answer should be either A or B or C or D. However, they are matched in such a way that you need to analyze both these statements and then come to a conclusion.
It's worthwhile spending time to master this section because this section is having the highest priority when it comes to tiebreaker. Okay.
Because
So this
this
is going
tests,
to
I
take
think,
you.
the higher level of analysis power, and it also
Yes.
tests more of the depth of knowledge in a particular topic. Hence, those who have got this right, I think that tie-breaking person should get a higher advantage. Is that not? Is that the reason, Anish?
Yes, yes, exactly. Because section B and C, you have to sweat it out. So section C, this is a different skill. Like it's not very routine to our regular curriculum. So we need to practice it. That's why we are providing the practice sessions.
So we want
So this,
Olympians to be really Olympians in thinking. The thought
yes,
process should be exercising all the graces.
swifter, faster, and accurate. So, participants, you have the option to raise your hand. You can speak out. We can discuss. We are all open to your suggestions. Clear your doubts. We have a good panel with us. Yes. So, we'll go to the responses. Yes. This is a
All right.
response.
So we come back again. The assertion statement, is it right or is it wrong? That's the first thing. So about 58-60% of you have marked that both assertion and reason are correct statements. And only about 4% have marked, only about 10% have marked choice D. So let's go back and check. Assertion, rigidity during this MH after giving succinylcholine is due to calcium flooding. The key word here is inside the sarcoplasmic reticulum. So you have to quickly think, does it happen inside the sarcoplasmic reticulum or is there calcium flooding outside the sarcoplasmic reticulum? So it's a tricky question. But you need to know your physiology, right, to understand that calcium flooding doesn't happen inside. Because sarcoplasmic reticulum, if everything is inside, then there won't be any muscle contraction. Instead, the ryanodine receptor is the reason. So that our statement is correct. But A, because of the defective ryanodine receptor, the calcium cannot go back into the sarcoplasmic. It stays outside. So that means it's a slight twist in the way the statement has been placed. So assertion is incorrect, but the reason is correct. So the choice in this case, the correct answer is choice D. Only 10% of you have got it. I'm happy at least 10% of you have got it. I hope it should not be a fluke. No, it should not be guesswork. It should be reasonable analysis of the two statements, and then you should arrive at your answer. And what seems very obvious may not be the obvious answer. So go back and analyze and check why this has been worded in such a manner.
We need to read through the question very carefully.
So we'll go on to question 3.
Okay.
So question number 3, let's read the assertion statement. Some of these questions will have very long assertion statements, but I'm reading it for your benefit. The assertion statement says, for non-obstetric surgeries requiring general anesthetics in pregnant patients, it is better to reverse muscle relaxants with neostigmine and atropine instead of neostigmine and glycopyrrolate. This is the assertion statement. The reason statement says glycopyrrolate is poorly transferred across the placenta with a fetal maternal ratio of 0.13, whilst atropine and scopolamine cross the placenta easily with a fetal maternal ratio of about 1. So these are the two statements given to you. Again, you have to think if both are correct, your choices will be either A or B. If one is right, the other one is wrong, then your choices have to be C or D. So you narrow down your thought process between A or B and C or D. And once you do that, then you have to dive in again and check whether A is correct or B is correct. So it's a good way to take out 50% of the probability and then analyze these statements again.
Okay, we'll go to the answers.
Yep. So I think all of you would have analyzed it. Great. I think more than 45% of you have analyzed it correctly. That assertion statement is correct. And the reason statement is actually the reason for the assertion statement. So again, I'm coming back to the statements for non-obstetric surgeries in pregnant patients. Reversal should be done with neostigmine and atropine. Why? Because atropine crosses the placental barrier. So that is a reasonable good way of thinking. The reason is the correct explanation for the assertion statement.
Okay, we'll go to the next question.
Yep. The next question, question 4. I'm reading the assertion statement. It says symptoms of compartment syndrome include extreme pain, unrelieved by analgesics, with paresthesias, with paralysis and pallor. So it says symptoms of compartment syndrome include extreme pain, within bracket unrelieved by analgesics, paresthesias, paralysis and pallor. The reason statement says muscle injury in the compartment occurs due to ischemic and hypoxic edema at tissue level, with peripheral pulses and capillary refill still likely to be present. So read both the statements independently. Think whether the statements are right by themselves. If they are right, then your choices become between A and B. If even one of them is wrong, your choices become between C and D. So that's how you're going to segregate and come down to 50% probability.
Practicing this kind of questions can actually let you arrive at your answer faster, because as we mentioned, the choices are going to be the same. All the 5 questions in the section C will have the same choices. So if you are familiar, you need to spend less time on reading out the choices because you know what it is. But you need to spend more time on the question part. There are 2 statements. Evaluate both statements.
It's also important to read through the statement repeatedly to find the finer points behind why the statements have been worded
Yes.
like that. That might help you arrive at the answers. There's another possibility these questions will have a lot of information given in the assertion and reason statement. Some of them would be given there as distractors, so you need to watch out for them and then come to your answers. All right, so about 50% of you have said assertion is correct, but reason is incorrect. So more than 50% of you have actually felt that the reason statement, muscle injury in the compartment occurs due to ischemic hypoxic edema with peripheral pulses and capillary refills still likely to be present. I think the moment you read that, you felt it is incorrect. But see, that is what is important. Capillary refill and peripheral pulses may still be present till a later stage, but they would have had symptoms even before that. So actually, the reason statement is correct. The assertion statement is obviously correct. Most of you know about that. Now the question is matching the two. Is the reason statement the likely reason for the assertion statement? Most of you will feel no because you feel peripheral pulses, capillary refill is still, but it says likely to be present. So even with peripheral pulses present, you can have all the features of pallor, you can have pain, and compartment syndrome behaves presence like that. So that's why compartment pressure monitoring is more important and more sensitive than actually going for the clinical signs and symptoms. And by the time you know the pulses have disappeared, it's too late, and there will be a lot of ischemia of the muscles by that time. So decision for fasciotomy comes much earlier. So it's good to understand if any of you have seen some patients, you would understand that. And anyway, so the answer in this case is the assertion
Option
and
A.
reason are
Right?
correct, and reason is a correct explanation for the assertion A. So about 20% of you have got it correct.
Actually, there are too many A's there. Option A, assertion statement A.
But I think the general structure of the questions of this section will remain the same, irrespective
Yes,
of how
yes.
we change the nomenclature. Your thought process remains the same. We will not change that because your preparation has been in those lines. We are giving you that input.
I will
All right, can
take this question.
Ananthapadmanabhan take this?
Yeah. Yeah. Dr. Abhyuday.
Question
Abhyuday,
number
sorry.
five.
Abhyuday.
Question number 5 is that assertion is PT or INR can reflect acute liver failure more quickly than can albumin. And the reason given here is coagulation factors have shorter half-life than albumin. So you have to choose between all these four options. These all have been dealt in detail, the options and how you have to go along. Whether assertion is right or reasoning is right, then you chalk out the options. So which gives more quick, either albumin or INR? Which one of these will reflect acute liver failure more quickly? If you have that idea, you can make it correct.
As we practice alone, we need to be more quickly. Not now, maybe subsequent sessions.
So most of you are correct in this. Yes, PT or INR reflect acute liver failure more quickly, means INR will be raised or PT will be raised in case of acute liver failure than hypoalbuminemia. Hypoalbuminemia comes late in ALF. Then the reason is that coagulation factors have shorter half-life than albumin. The albumin have a half-life of around 19 to 20 days, while coagulation factors have a ranging half-lives. Like factor 7 have a half-life of just 4 hours. That is the smallest half-life a coagulation factor have. That is 4 hours for factor 8. And factor 13 have the longest half-life. In some books, it's written 5 days. In some, 8 days, like that. So in that, obviously, assertion as well as reasoning both are correct. And yes, reasoning is the correct explanation of the assertion statement. Next question.
Option A is the
Option
choice.
A is correct. So next question is, assertion in this question is Pringle maneuver, which is used during the hepatic resection. It is used for reducing blood loss. This is the assertion. Reason given is that the clamping of infrahepatic IVC minimizes the hemorrhage in the setting of an elevated CVP. So this is the reason given. of the assertion provided. So first we have to see whether assertion is correct or reason is correct. If any one of these is incorrect, then you can straight away go to option C or D. If both are correct, then you have to see whether reason is the correct explanation of A or not. So in this question, option B is correct, means both assertion and reasoning are correct, but reasoning is not the correct explanation of the assertion. See, Pringle maneuver is used by the surgeons intraoperatively to reduce the bleeding during hepatic resections. So this is the correct assertion is correct, statement is correct. Now the reason is that in the Pringle maneuver, actually it is not the clamping of the inferior infrahepatic IVC that is clamped. In the Pringle maneuver, we clamp the hepatic artery and portal vein, that is the main supply of the liver. We clamp that at the hepaticoduodenal ligament. So that is the reason why it reduces the blood loss. But yes, reason statement is also correct, because clamping of IVC is also a method, but it is different method than Pringle maneuver. So clamping of IVC also decreases hemorrhage, and it is used in cases in which CVP is higher than 5 mm of mercury. Usually in the hepatic resection, less than 5 mmHg of CVP is required. So Pringle maneuver is used in cases in which there are high chances of blood loss. So the option B is correct in this question.
Okay, we'll go to question number 7. Now it's Dr. Ananthapadmanabhan.
So coming to question 7, the assertion statement is sevoflurane is preferred over nitrous oxide in neurosurgical procedures, and the reason statement is sevoflurane has minimal effect on cerebral blood flow and does not cause air expansion in potential intracranial air pockets. So you're already familiar with the options. Option A is both A and R are true and R correctly explains A. Option B is both A and R are true, but R does not correctly explain A. Option C is if the assertion is true but the reason is false, and option D is if the assertion is false but the reason is true. The poll is open.
Relatively quicker response. If some more people respond, we'll go to the answer discussion.
So 98% of you have correctly answered it as option A. That is, both the statements are true and R is the correct explanation of A. So nitrous oxide is not preferred in neurosurgery, as it can rapidly diffuse into the intracranial space and can have deleterious effects. So sevoflurane is preferred over nitrous oxide due to this reason. So the next question is liver cirrhosis. The assertion statement is liver cirrhosis can lead to an increased volume of distribution for many anesthetic agents. And the reason statement is that cirrhosis is associated with increased plasma protein levels, leading to enhanced drug binding. So option A is both these statements are true and R is the correct explanation for A. Option B is both are true but R does not correctly explain A. C is A is true and R is false, and D is A is false but R is true. I will just repeat the question because we don't have the text up on the screen. The assertion statement is liver cirrhosis can lead to an increased volume of distribution for many anesthetic agents, and the reason statement is cirrhosis is associated with increased plasma protein levels, leading to enhanced drug binding. Shall I tell the answer,
Yeah,
sir?
proceed with the answer because you're unable to project it.
Okay, so here the answer is option C. That is, the assertion statement is true and R is false. So here the recent statement was that cirrhosis is associated with an increased plasma protein levels, leading to enhanced drug binding, which is not the case. In cirrhosis, there is decreased liver function that can lead to decreased plasma protein levels. So here the recent statement given is false, but the assertion statement, which was liver cirrhosis can lead to an increased volume of distribution for many anesthetic agents, is true. So here the correct answer is option C, that is assertion is true but R is false. Shall I move to the next question?
Yes, yes. Last question
So,
also I am unable to show. Sorry.
okay. So the last question is assertion statement is hyperkalemia is not a concern during renal transplant surgery since the new kidney corrects potassium levels immediately. And the recent statement is hyperkalemia can persist postoperatively due to delayed graft function and continued metabolic abnormalities. So option A is both A and R are true and R is the correct explanation for A. B is both A and R are true but R does not correctly explain A. C is assertion is true but reason is false. And option D is assertion is false but reason is true. I'll just repeat the question once more. The assertion statement is hyperkalemia is not a concern during renal transplant surgery since the new kidney corrects potassium levels immediately. And the recent statement is hyperkalemia can persist postoperatively due to delayed graft function and continued metabolic abnormalities. I'll move on to the answer.
Okay.
So here the correct answer is option D, that is assertion is false but R is true. So here hyperkalemia is a concern during renal transplant surgery because it takes some time for the new kidney to start functioning and correct the potassium levels. So here the assertion statement which was given was wrong because it is not able to immediately correct the potassium levels. And here the recent statement is true because hyperkalemia can persist postoperatively due to delayed graft function and can cause continued metabolic abnormalities. I think that's it
Okay,
for our section C.
yeah. Okay. So with that, we come to the end of today's session.
Yeah, there was a question put to me by one of the postgraduates whom I met. Saying that, do you have any books which you recommend to read for this?
Right now, we don't have a recommended set of books.
Yeah, I think the topics are sort of which is covered entire gamut of topics. However, they may get some practice questions on similar lines if they go for any of the FRCA preparation books or the American board exams. I think they'll get an idea about the type of questions which are setting. Though I think the syllabus and the curriculum is going to be all across all the subspecialties of anesthesia. So there's nothing specific we are recommending, but it's good that they practice these kind of questions. It will help them in their preparation even for their fellowship exams and so on.
Yeah, I think in the candidates group, if you find any book interesting, just suggest it through the WhatsApp group. We'll discuss it out, and in future we'll try to have a suggested set of books
Yeah,
also.
it's not for the knowledge part. It's basically for the pattern and to give them some practice. That these are type of questions and to get those keywords in their mind that they can register it and then start analyzing the questions. It's only for that purpose.
Correct. So we'll wind up for the day. Jayashree ma'am.
Great. That was a great session for the students, I'm sure. And Nidhi saying, will we get result also in mock exam? Nidhi just asked this question.
No. Mock exam is just for a practice. You don't get to get result. Anyway, next week we'll have our IT expert. We can clarify with them. Okay. I don't think they'll be providing a result. Even if it is, it may be a score only. Because ultimately what matters is your rank rather than the score. Yeah. Because this is a competitive exam.
Right.
That's the role of Olympiad.
So, thank you very much, Dr. Aravind and Dr. Ananta. And Saneesh, thanks a lot. And so we see you all at the mock exam, students. For the mock exam, next will be the mock exam.
And another 2 preparatory classes.
Another 2
next Friday so and the coming Tuesday.
Yeah, lovely. So we'll be seeing you next week.
21st and 25.
All the best. Thank you. Good night. Thank you, Rituparna.
Good night.
Thank you.
Good night, Mukul sir.
Thanks, Mukul. Thank you.
Good night.
Good night.